Very important, we showed that a girl with a caterpillar on the back of her arm, serial examination. You have to document, write on the paper in black and white, in the language which everybody is able to interpret and read. Document the progress of the damaged nerve. I'll show you the photograph. Progress of the tennile sign, tenderness of the muscles, and the brachioradialis. So we had this girl who was seen on 1st January 21, and the tennile sign was here. Every 2 weeks she came to us. The tennile sign made a progress. So from the lateral epicondyle you make a marking. Where is the tennile sign? The strongest tennile sign. And sure enough, it progressed by about 3 centimeters. So there's so much distance. So 30 millimeters in 30 days, it's a good progress. So we could predict the nerve is recovering. So progress and documentation is important to prognosticate this nerve is recovering or not recovering. Next thing is brachioradialis. Mid-prone, if the brachioradialis has recovered, so brachioradialis recovery means the nerve is recovering. This is followed by recovery of other extents of the wrist. But there are indications for immediate exploration. If it is open injury only means the injury has been severe enough to cause further damage to the nerve, and possibility of nerve being involved is high in an open injury, and therefore explore it. You are trying to reduce the fracture, it is not getting reduced, that means some soft tissue is interposed. Always presume it is going to be the radial nerve alone, and therefore open and reduce this. You are trying to reduce it, it's not getting reduced, it's unacceptable, do it. Vascular repair, of course, requires exploration because you are anyway opening. Reduction, but now it has become radial nerve deficit. These are the patients who requires exploration early. Otherwise, you wait for at least 4 months. What are the surgery? Surgery is done either on tendons, surgery on nerves, or surgery is done on the muscles. What kind of surgery you do on the nerve? Either you repair the nerve end to end, you put nerve graft, it's a deficit about 4 to 5 centimeters or less. Vesceroid nerve graft or direct nerve transfer. I'll talk about this. So these are the type of surgery you do on the tendons. You do surgery on the tendons, which is the tendon transfer. Or you do surgery on the muscles, which is a function. Nothing is available. Tendons are not available, nerves are not available. You do microsurgery to take out muscle from some other part of the body to transfer it there. When do you do nerve surgery? If the recovery of the radial nerve function may be expected if proper repair is carried out within 15 months of injury. So if you expect the nerve is going to recover with a proper nerve repair, do the nerve repair, nerve grafting, nerve transfer. But if you think it's not going to work, don't waste time. So this was one of our patients few years back, and he had a deficit in the posterior aspect of the arm behind the humerus. We put a nerve graft, sural nerves. Did it work? Sure enough, we followed it up, and after 4 years we took the photograph. Not that it took so long to recover. They recover very fast. It's one of the most safest nerve for recovery. They recover very extreme fast. You agree with me? So this is one of the fastest recovering nerve. Radial nerve repair, grafting, and they do extremely well. Good function. Good extension of the fingers, wrist and thumb was achieved. What is nerve transfer? It can be done in association with tendon transfer or instead of the tendon transfer. And what you basically do, you spare a nerve from one of the spareable muscles and transfer it to where it is required more. Again here, this is the median nerve, this is the radial nerve. You take out one of these branches going to one of the nerve. This was probably going to superficialis, and this was transferred to extensor carpi radialis brevis. So one of the nerves from the median nerve is transferred to one of the nerves of the radial nerve. So this is nerve transfer. Why FDS? Because FDP is going to do the job, and FDS nerve therefore can be spared to use for wrist extension. So this was nerve grafting, nerve transfer. Now, if that is one aspect of the treatment, the second option is tendon transfer. What is tendon transfer? It's a redistribution of the muscles, redistribution of the tendons. It's a strategic redeployment of the expandable functioning muscle tendon unit. What are the indications? You have done a nerve repair, and in reasonable time you find the nerve is not showing any function. These are the patients who require a tendon transfer. Because you feel like I showed that in gentleman, injury in this part of the body, and you think you do any nerve surgery, it's not going to do any justice, do a tendon transfer. Extensive injury, again that gentleman is not expected that he will do well, and therefore he is a candidate for a tendon transfer. Patients come a year, 1.5 years later, doing any nerve surgery is not going to be work, or probably it may not work. Therefore, one short method, tendon transfer. Elderly patient, you keep waiting indefinitely till he stops using the hand. Don't waste time. Just do tendon transfer 1.5 months. He'll have a good function.